I think, or at least I've heard people talk less about how VO2 max or endurance training in general can affect health span. So you talked about the cognitive benefits there, and I think that plays a big role in health span. What do you find otherwise in terms of how endurance training can benefit health span? I think it's more obvious or intuitive when it comes to resistance training because, the first thing at least I think about from, working in healthcare with elderly patients is, being able to just get up out of the chair or roll over in a bed, or, being able to walk to and from the bathroom on your own and stuff like that, or carry, groceries. What do you see in terms of health span outside of just the cognitive stuff you listed for benefits of endurance training?
Yeah, that's a great question. And I always think it's important definitely to talk about the lifespan versus health span. And the way that I've always thought about it too is that I think they are somewhat distinct. Obviously, lifespan is how long you live. Health span is more related to quality of life. But to me, they're also kind of very interrelated because I don't see a instance where someone would have, say, poor health span, but like a long lifespan. So, I mean, if you're, unhealthy and frail, the odds are pretty low that you're going to live a pretty long life. And I think the same goes with like, you could live a long life with poor health span if you're on a ventilator or like in a hospital bed or something like that, of course. So there are certain situations like that, but I definitely think that they're coupled. So a lot of things that we do to improve, I think we should focus more on health span because if you focus on improving health span, I think the lifespan benefits sort of are a side effect of that, a beneficial side effect of that. So, but regarding your question on why endurance training would be important for health span, I think just as you mentioned, like muscle mass and strength are important for just those activities of daily living, getting out of a chair, getting groceries, walking upstairs. Something similar actually is present for VO2 max. So there is a frailty threshold, I think that might be the correct term of it, for VO2 max, below which you really can't do the activities of daily living that we had just mentioned. I think it's around 15 milliliters of oxygen per kilogram of O2 per minute, so relative VO2 max of 15. Below that, your body is simply just not capable of producing the energy that's required to do those activities of daily living. So, you obviously need strength to do all these things, but, just to like walk around the block, that obviously requires aerobic metabolism. So your body has to be able to produce energy or produce ATP using oxygen. And so your VO2 max is important for that. So a declining VO2 max will reduce your health span as well. And, it's another one of those concepts that I would think I would attribute to like Peter Attia, but it's the idea of like back casting your VO2 max. So you say 15 is like this threshold that if you dip below this, your quality of life kind of sucks. You're going to be confined to a chair or a bed or something like that. Okay, so when do you want to maybe you hit that threshold at 99 years old. Okay, great. Most people would probably be happy with living to like 99 in pretty good health. So if you want to hit that threshold at 99 and say your VO2 max is going to decline 10% per decade, or what some of the estimates say, after age like 30 to 40-ish. So say 40, your VO2 max starts declining 10% per decade. What do you need to be at to reach that 15 at age 90? And so you could kind of backcast from that to see what your VO2 max needs to be. And regardless of the specific numbers, I think the relevant application there is just get your VO2 max as high as you can up until middle age before it starts to decline, and then you'll kind of be good to go. You're like investing in like this savings account essentially that you're then drawing from as you age. Is kind of the way that I think about it. And it's interesting because even in people who continue to train, masters athletes and people like that, VO2 max still tends to decline. So it appears that, and obviously, so if you're unfit and you're 60 and then you start training, your VO2 max can increase. So I'm not just saying it's a linear decline from middle age onward. But if you're considerably in shape at age 50 and you've been training for your whole life, the chances are that your VO2 max will start to decline after that age, even if you continue to train. Probably has to do something with the declines in our maximal heart rate for one. So our heart rate drops about 1 to 2 beats per minute as we age. So that probably contributes a lot to it. among other changes. So yeah, I think the health span benefits of VO2 max, like you mentioned, the cognitive function is important, but just that ability to participate in activities of daily living, it also requires a high and a functional VO2 max. So I think that's why the endurance training would be important there as well.